Hello, good afternoon, everybody. Welcome to the 24th edition of the Health System Fix podcast. My name is Dr. Gaurav Mishra. I'm a child, adolescent, and adult psychiatrist and a health system design expert. I've been asked to tell you this. Please like, subscribe, and share the podcast. It helps it grow and supports the work. I'm really excited. My guest today is Dr. Manisha Sharma. Firstly, she's a friend and a mentor. I value that a lot. Dr. Manisha Sharma is a board certified family medicine and social medicine physician. She's dedicated to advancing health equity. She works at the nexus of clinical innovation, patient care, and health policy with a passion for designing care delivery systems that promote health and well being for all. Most recently, she co founded and is a chief care innovation officer for MitoKhon Advisors, which is a women led, physician led, and BIPOC-led social impact design firm. She also has co-founded Civic Health Alliance, which is a nonpartisan coalition focused on voter registration for health professionals and patients, and also is a co-founder of Centivox, which helped empower healthcare providers as trusted messengers in public health communications. So welcome, Manisha. Thank you so much for joining us today.
Thank you for having me. And I feel humbled that you think I'm a mentor. So thank you. I appreciate that.
Whenever we talk, our conversations are so interesting. I walk away learning so much. And, you've definitely helped guide me in many questions I had. So I appreciate that. Let's get started. I would love to learn a little bit about early life and what was that like growing up?
Well, that's a great question. So I am an immigrant's kid. I'm the firstborn in the United States. My father was from Pakistan. He was born before the divide. My mother is from Rajasthan, India, and so I was born in the early 70s. They came during sort of the open immigration policies that we had then. That was very much about this country. And I was born in New York City. I was born in Spanish Harlem. I'm a New Yorker. And so, yeah, and that was in early life. That's where I was. I'm the firstborn, a girl. And as you know, there's a lot that can be said about our South Asian community and our social sort of structures. And so a little bit about me. I think I always wonder if I was born in the wrong culture just because I was that loud New Yorker kid. It was very much, I felt like my parents really, because they were immigrants, I think they sort of had that story of, well, you're supposed to be a doctor, you're supposed to do all these things. And I never fit the bill. And then, but there were things about our culture that I think I took very much to heart, which is my siblings that came after me. We had chain migration. My aunts and uncles are like parents for me. They came, they lived with us. My cousins were born, who I call brothers and sisters. So I took a lot of responsibility of being the eldest. And I really take pride in that. I think it shaped me a lot. But I really felt like my identity crisis was I wasn't quite Indian enough. I wasn't quite American enough. And so I sort of dance to the beat of my own drum, if you will. Yeah.
Just a couple comments I want to make because recently I've just picked up a parenting book. I have two boys, 6 and 9, and it's what it said was adults don't raise mature kids. Kids create mature adults. So
Right.
just a few minutes to absorb
that. Exactly.
I assume that was the mature one there, but it's actually kids who push you to actually broaden how you view things.
Yeah, I think for me that my parents, in reflection, my mom is still with us and my aunts and uncles are that really raised me in a lot of different ways. I think in reflection, there was a lot of learning on both sides. I think I was that kid that pushed the envelope of why I can't go out with my friends, why I can't go and do, go to prom or do any of those things, why I can't date. And when we were in New York, we moved when I was 13 years old to a small town called Syracuse, Kansas, where my mother was the only physician sort of in a 100-mile radius. And I was always the foreigner's doctor. And, when you come from a place like New York and then you go to this really small town that's like a blink of an eye and you're 13 years old, there was thing that hit me the most was this need for the immigrant experience to assimilate to what they think America is. And I just think a lot about myself. I didn't have language around it back then, and I didn't have sort of the know-how, but I knew it was wrong. Like I'm not a white American. I don't fit that bill. And so I think there's that immigrant experience also from where our parents or where my parents came from and where you're from, is just over colonization and what that actually meant and how that shaped a lot. And so my pushback where they learned from me, I think, was to question what is the status quo and why assimilation really isn't the way to be. And that isn't the American way per se, right? And then the other piece is I could have handled a lot of things much better than I did being sort of an angry teen, if you will.
Right, right. Well, yeah, I think parenting also, when we do it for ourselves, teaches us so many lessons that, oh, this is what our parents dealt with growing up. So you mentioned your mom was a physician. And so tell me a little bit about your early inspiration of thinking about healthcare and what do you want to go into? What do you want to be in healthcare?
Yeah, so much to my parents' chagrin, I did not want to be a physician. I actually wanted to be a musician. I went to Berklee College of Music. That was my first career. I went to sing. I wanted to heal the world through dance and music, which again was much to my Indian immigrant parents' chagrin. I entered healthcare as a patient. I actually got hit by a car while crossing a crosswalk while I lived in Boston, and it really changed my trajectory. I had 4 big major surgeries of my hip. I went to music school and I was a dancer and I did all of those things. And so for me to sort of adjust to that, I never went without. I lived in privilege in the sense that, I got the things that I needed to be a healthy human. When you hit health insurance, this is before the ACA, this is in my early 20s, I'm aging myself, so I'm 52 now. And it was the health insurance companies could say, well, due to a third party, now you're a pre-existing condition. So I got dropped from my health insurance. So imagine being 21, being sort of these piles of medical bills. And so I got angry and I started to learn a lot about health systems and I became a patient rights advocate. And then I thought, as I got to meet more and more people who had stories that were worse than mine, and I just realized this is bigger than me. And so I started to educate myself over how does health operate in the United States. I happen to be in Boston, which is an amazing place to be to learn this stuff. I joined single payer movements. I joined health rights advocacy organizations. And so in my early 30s, I thought, well, the best way to sort of have power and influence and being a patient advocate was to be an activist. And so I thought, well, I'll be that person's doctor. So I didn't go into medicine because I loved medicine. I went into it because I really loved people. And I realized that this system that we have is so fractured. And when you come through it through this lens of being a patient, it really humbles you in so many different ways. Being told you're a pre-existing condition because you're a woman, you got hit by a car. Now, you have pain. What does those things mean? And now you're told we're not going to cover you because you're this and it's your fault. That's really like jarring, right? And so that's really how I entered into the healthcare space. Not, again, I love science and I love it's just a curiosity, but I really love people. And that's why I chose family medicine and social medicine.
Do you think to some extent when you were going down the journey of being a patient advocate, do you feel like it was not being taken seriously because you were one of the patients representing patients? Do you think that's the kind of culture of medicine does that? Devalues people who don't have the degree. Do you face that or was that part of the thinking?
Yeah, I mean, I think there is moments of that, right, where I was young, I was in my 20s, I'm mad, right? Like, those things. And so I think there's elements of that, but I also have a big mouth and I also knew how to create relationships with organizations that really knew how to strategize. Marshall Gans was also in Boston and I learned I had a lot of really great people around me in Boston that pointed me into different places and spaces and people. Marshall Gans was a teacher and still is a teacher at Harvard, at Kennedy School. And so I took a few classes from him and got to meet him and really learned from him over what it meant to be strategic in how to get your voice heard. And so I really feel fortunate that if I didn't, I made sure that I was heard. And then I would bring people along. And I think now in medicine, I tease a lot where I'm in the belly of the beast, right? To give it GERD, I'm going to make them have a lifestyle change. I'm going to have them to take a PPI. Otherwise, they're going to hear from me. And many times people just don't want to hear from me. So it's a good way to do it.
In healthcare, if people don't want to hear from you, that's a good sign.
Yeah,
You're
that's right.
talking
We're
about,
doing something right.
I'm thinking, like, for me, the humility of understanding the patient experience and why the service that I was providing or our system was providing I was like rose colored glasses. I entered medicine. I've always wanted to be in medicine. And that came maybe even 6 years into practicing medicine post residency, right?
Mm.
It kind of clicked. Okay, we are not doing enough and we are not even doing the bare minimum well in many cases. So you go into medicine with this lens. How's that experience of going back and forth in your, how do you view the system? Did you feel that change as you went through training and medical school?
Yeah, I think one of the things that I think we have to recognize is that our training in healthcare is toxic in a bit. There are champions that we have, we meet each other, we find each other. But I think we have to really have a big acknowledgement that we are trained to sort of blame and shame. You're the problem, that we have diabetes. You made bad life choices. If you just eat right and you just exercise, you'll be better. Take your medicine, right? I told you to take your medicine. So I think we're trained in the system. The system is set up to sort of blame and shame. And I think we also are trained in a system where we always talk about what's the matter with people versus what matters to people and what happened to people. And I think that human lens is really, I think we have to acknowledge that the system's archaic on how we train. I think we have to acknowledge that the system's based off of structural racism. One of my mentors was Kamara Jones and Jack Geiger. We learn from the greats that we stand on their shoulders and we learn at their feet. And, I think we have to acknowledge that the system is built for us to make it so people are harmed by the system. So I think there's a lot of us that are really wanting to flip that script. I think for myself, I've got very intentional. Like I said, I didn't go into medicine because, we all say it, we want to help people, but we don't really sit back and reflect over what are we doing that's inadvertently harming people. And I love that I'm in part of collectives that really want to ask that question and really hone in on it and are unapologetic about it. And I think that part is really important in surrounding yourself around that.
I think as a medical professional, the view we take for our patients has been forever too narrow. You view them in the 15, 20-minute time slot that they have without acknowledging the context that they come with and what they're going back to, right? That their lives actually exist outside of your appointment. And just, I think that has not really been effectively captured. And even today, how you do history taking, how you do
That's
evaluations
right.
doesn't capture majority of that information.
I usually start my clinical care when I see patients. I always say, my name is Dr. Sharma. You got good karma when you know Sharma. How may I be of service to you today? And part of it is on my sheet, it'll say it's a physical, or on my sheet, it's a medication refill. But that stuff is very recipe baked. I want to know what matters to people. Tell me a story about you, right? And even in a 15-minute encounter or a 7-minute encounter, you can gain so much by what you're seeing, hearing, feeling, touching, smelling, right? There's so many things you can gauge without having to ask those questions that are so archaic in nature and just sort of rote. I think we have to say, like, we know this. I mean, we talk about health equity, we talk about social justice, we talk about all of these things, and I think we were moving in the right direction because it became a non-stigmatized thing to talk about. I think in today's reality of where we are in 2026, I think we have a lot of work to do just because it's being stripped from us to be able to look at people with a humanity lens. And because there's pressures that are coming from federal government and how we do business in healthcare that is telling us that we need to be widgets in the system. And I just don't ascribe to that.
Yeah. And I don't know what your thoughts are on like data-driven healthcare. I think data-driven healthcare is definitely has a important place, but it almost invariably we're looking at the data that helps the health system and not the patient in many
Right.
cases.
That's right.
So it is really driven towards meeting the goals to make sure funding is in place, even nonprofits, frankly. So I think, the data-driven healthcare is important, but it is not considering what the patient needs. And second, it's also becoming almost dehumanized in some ways by just focusing on the numbers. What are your thoughts on that?
Yeah, I mean, data can tell us a story, but it's not the story. I think you're right. I think it does, a lot of it is business driven, but I do think there's a population health piece to that. I think what's interesting about data in today's day and age, especially being in California, just anywhere, but is that the data can also harm people, meaning that if you are without papers, right, in California, for instance, in Medi-Cal, which is our Medicaid system, people, regardless of their immigration status, were allowed to be able to get Medi-Cal. And now we have a freeze on newer people to go. But their data of where they live, who they're with, how that stuff sort of got exposed. And we have EMR data that we spent trillions of dollars on to share, to get data so we can all talk to each other about how do we make people's lives better or help them get to the place of thriving now is sort of inadvertently outing people where they live. Do they have papers? Do they have a social security number? So my feelings of data is I think data is important. I just think we now have to really think about the chess game a little differently. Um, because there are people, if you're a woman, you want to seek abortion services, like if you are trans, needing gender affirming care, like those types of things are now it's harming people if that data is out there. So I've been thinking a lot about how much time and money we've spent on data and sharing data. And now I think sometimes that's important, but then the other piece is like, oh my gosh, what do we do now differently so we don't hurt people?
Right. Tell us a little bit about your work at Doctors for America.
Yeah, so Doctors for America was Doctors for Obama at first. We were sort of a grassroots organization. It was co-founded by Vivek Murthy, who was our Surgeon General, and another individual that was part of Move On. And then and so we were just a movement actually to really sort of get President Obama elected at that time. When President Obama became elected, we then became Doctors for America. We realized that we actually needed to be a part of the conversation that is different from institutional societies, right? Like the AAFPs or the pediatric, like it had to be different from the academic institutions. They have a very important place, but what do you do when you want to do grassroots work? And so we became Doctors for America. It was an amazing time. We were a part of a lot of the discussions that were on the healthcare landscape. One of the agenda items for President Obama at the time was now what we call the ACA, and really being able to have sort of this expertise at the table to help guide sort of what do we see with our patients on a day-to-day, what is happening in our communities. And so I was a part of that leadership and just really moving, getting people organized. And doctors don't tend to organize very well. We were virtual for a long time. And so I was in New York at the time. And so we were able to pull us white coats to the ground. And so I was one of those leaders that really did a lot of work on really creating a grassroots movement across the country, frankly. It was beautiful.
Yeah. I'm thinking that a lot of the institutional physician organizations often tend to be doctor first, not patient first. So I'm thinking that what you're describing is something that is more grassroots in the sense that how do we figure out the work we are doing and how do we do that better?
Yeah, I mean, I think, academic institutions are also about academic institutions. And I think having a voice as a concerned citizen who happens to be a doctor, who happens to really believe in communities, It sits outside of an institution. I'm not saying that institutions aren't a part of those conversations. I think they're important. But I think what we really did for Doctors for America was gave us as physicians and even nurses were a part of medical students a different space for voice that allowed for us to be able to say, look, I care about my community and I care about my patients that are inside the walls, but I also care about them outside of the walls. This is why it matters for us to be part of these discussions. I think as physicians, we tend to forget that we have an identity that's past our white coat. We're constellations of identities, if you will. I'm a mom, I'm a doc, I'm an activist, I'm a community member, I'm the PTA, like, it's like all of these things. And who happens to be a physician, who happens to have an expertise, who happens to have, blah, blah, blah. It goes down the sort of line. And I think we just never really had space for that. We've had organizations through time. But I think what made Doctors for America so special, and it continues to be, it still exists, was that we had a group of really fired up, fire in the belly physicians and nurses and med students who really wanted to make a difference. We also had an administration in the White House that was very open to connecting with community, which I don't think we've ever had since President Obama's days. At least I haven't felt it. I think we've had elements of it, but not there. And I think those things were just such a great time, like a culmination of things to happen. And I think as a physician, it gave us hope.
Yeah. Okay. You also co-founded Civic Health Alliance. Tell us a little bit about that work.
Yeah. So first we were Vote Health 2020. It was four of us who started it. Dr. Sela Safo, Dr. Ali Khan, Dr. Saranya Laura, and myself. And we really believed, at that time we had Healthy People 2020, which was actually government-based sort of a healthy people at hhs.gov. And it really was saying civic engagement is also part of your health. We know that wealthier communities tend to be healthier and they tend to vote more. So the question was, how do we create a space where we're able to get professionals like ourselves to go and take their civil engagement rights to actually go ahead and go vote, but also to educate our patients to actually think about it as a preventive care measure. One of my early on mentors was Dr. Rishi Manchanda, and he actually had started RX Votes a long, long time ago. And I really, that really was like a big deal. And I think when I was in residency, I actually created that as a project to do voter registration within health communities and within health centers. Vote Health 2020 really was like, how do we get people to say, in their exam rooms to educate our patients to vote? So now Civic Health Alliance is now a culmination of that. Stella Sappho is our CEO. We're a nonprofit and we still doing the same work. It's really important to understand that our voices matter as healthcare workers who do this work. I think COVID was a really great sort of teaching moment for us where the system broke and we needed to vote to show that we needed a change in how we do healthcare and healthcare delivery in this country. We're at the front lines to know what that looks like. And so getting our colleagues to vote, we know that doctors and nurses and healthcare workers tend to not vote as much. And the reason is because we're stuck at work. There isn't space, like no one's telling us, go take the day off to go vote. And then on top of that, we need to bake it into our healthcare system. Do you smoke? Do you wear seatbelts? Are you registered to vote? This is nonpartisan. This is not me telling you who to vote for. It's just me saying to you, this is part of your day-to-day health.
So over your career, you've worked in so many community-based organizations, also like social change organizations. You're also with two health plans until recently. So obviously, I think you viewed the system from many different lenses. Could you tell us a little bit about what that different experience brings? And I think we've talked about community-based. Maybe what does a health plan experience bring into the view?
Yeah, I mean, so I just be clear that I am very intentional in making sure that I work in Medicaid. My whole career is really serving folks who are uninsured or those who are receiving Medicaid as their health insurance. And, health insurance is how we operate in this country, unfortunately, to, get people to have access to care. Now, care that's quality and care that's safe is another discussion. But I think, I have a 5-foot lens, which is I still see patients. So there is this thing where patients teach us, right? It's very humbling to walk into a room where people are coming to us at their most vulnerable time to tell us their sort of what they're worried about for themselves. But also, when you sort of scale that 5-foot view all the way to a 30,000-foot view where the money sits, where it drives how we actually see people and take care of people, that transforms into sort of translates into care delivery, it's really eye opening. So I actually take those patient engagement and I take those experiences and then I can translate it all the way to the 30,000-foot view, which is on the policy side. Health is in all policy. And so when you think about just Medicaid in general or plan spaces in general, that actually is dictated by regulation and policy. And so when you take the patient viewpoint and you take it into those boardrooms and those meetings, it really humanizes the care delivery space and it translates what they're not seeing on the ground. And then I can yo-yo back and forth. I look at myself as a translator in a lot of ways. I think also understanding how policy can harm people and how policy can help people. Being in those spaces in a 30,000-foot view is also really important so we can testify and testimony for the voices that are not being heard on the ground to give people shaping and framing of how we are supposed to do this work.
For young clinical leaders or healthcare leaders, right? Oftentimes when you're doing the work, you have to be really in the weeds to do good patient care, right? But at the same time, we also want them to get the systemic lens. What recommendations would you have for young clinicians, young leaders? How do they broaden their lens earlier in their trajectory of career than much later?
So when I mentor a lot of med students or med students to be, or even my kid, just to just like, when I think what I always tell them is when you hear information, ask yourself the question, who's telling you the information? Who's telling the story, right? And, does it feel right to you? And then there's then you research and do all of the things and get yourself an informed opinion. Interpreting what you're hearing as being this is the right way to do healthcare, right way to do X, Y, and Z, and not questioning where this information has come from, who's telling that information. Think it's what I want them to have that skill from the get-go. And the reason is because healthcare in this country, healthcare just in general, is dynamic. It's not static. Medicine changes. We got new innovation, new ways of thinking. If you really think about how medicine was built in this country and care delivery was built, it was built on the foundation of structural racism. And so then it got codified as being normal, and then you train people into that. So I think that part is just questioning where you're getting your information, what it means, I think is sort of the first thing that I have people do. Form your own opinion, not just because I'm telling you or you're telling you. I just form your own opinion. Go do the research. Be curious. I think being curious is really important. That also translates into patient care. When somebody comes to you and says, I'll give you an example. I always tell this example because it's a funny one, but like I was an attending for a clinic, and it was a night clinic, and it was a med student, and the med student said, and we're taking care of folks who are without papers, and the med student and the patient was 30 something years old, and is like, oh, he's got severe arthritis in his knee, and so he's going to need like all of this stuff for severe arthritis in his knee. And I was like, yeah, but he's 30 years old. And I was like, I said, why do you think he has well, it's because his knee hurts and it's swollen and it's severe arthritis. And I was like, okay. I was like, well, did you ask him what he does for a living? Just,
Yes.
and he's like, well, why does that have anything to do with it? That was the med student's question to me. And I loved those questions because and I'm like, well, did you ask if he stands 16 hours a day? Did you ask him, is he on his knees 16 hours a day? Like, what does he do for work? That all of a sudden this knee is like hurting him and it's swelling up and doing all these things. And now you're saying it's severe arthritis. And it never occurred to him, right? And so I think being curious in any aspect of what you're doing really tells you ways to think about how you work. And when you're a leader, I think a lot about leadership. There are people in our healthcare milieu who are really amazing, smart individuals who really do like but they're not necessarily great leaders. They're toxic. And so I've learned a lot from toxic leadership. And I think it's really important. And so I think a lot about, we all have the potential of being leaders. I think we have all have potential to learn from what doesn't work for us as individuals. And so when I see young people, I always tell them it's like you decide what kind of leader do you want to be. And every experience that you have, whether it's bad or good, is a learning moment and a teaching moment, and reflect on that. Right. And I have chosen to clear about my leadership. I know what I don't know. I'm not the brightest bulb in the box, but I'm pretty bright. And so, and then and I also think about my own values and my own system and my own principles. And I'm very unapologetic about it. I'm now 52 years old, perimenopausal, and I have zero F's to give in regards to people telling me if I've succeeded or not. I really don't care. Honestly, to me, leadership is about being able to sleep at night and doing well by your own values and principles and doing well by values of humanity. So it doesn't have to be a title.
Right, right. By the way, like what people's opinion is, whether you're successful doesn't even matter. I boiled it down to what my two boys think of me is the only metric, maybe IRS is the only metric that I'm going to looking at, because it really absolutely does not matter as long as you're able to sleep well at night.
Yeah. And I think, I think about legacy that way. So I have a 10-year-old who is my everything, my pride and my joy. And I think a lot about like on my deathbed, what is it that I want, you know, that to be said as my legacy? And it's my 10-year-old to say that I was a good mom and I was a good human. And I really wanted to make the world a better place from my corner of the world. Right. And I know that sounds hokey, but it's really true. It wasn't about, oh, I was the chief medical officer of blah, blah, blah. And I wasn't I was the attending of blah, blah, blah. And I was a doctor. And it's like, yes, but no. And so I think the pieces, more than anything, it's been about being authentic and intentional of your own values and principles. And how do you show up in the world consistently? And that's what I tell young people today, because I have to tell you, the system can be toxic. And we see burnout in so many different ways. There's moral injury in so many different ways. And this is kind of why I decided to do my own thing. It's like I don't want to be owned by anyone. I want to be very true to myself. And I want my kid to look at me and say, I'm proud of you.
Right. That is that's truly the only real metric. I think, again, obviously, we are trying to make impact and make people's
Sure.
lives better, but at the same time, that metric really captures it all. The one thing about leadership in healthcare, I think a lot of physicians and clinicians make a mistake they make, I think, is they assume they're going to be great leaders. They actually have to invest time and effort in being a good leader. A good doctor doesn't equate to a good leader always. I wanted to ask you about how did you think about your own growth as a leader? I know we're both alumni of the CHCF Healthcare Leadership Program, very instrumental, for my growth also. How did you think about all of the new challenges you put yourself in front of throughout your career, and how do you level up? How do you improve your skill sets to meet them?
So I can first tell you about CHCF. I think the reason I wanted to do CHCF, it was a very cathartic moment for me. I just came out of very toxic space. And when I came to California, I felt alone, to be honest. I do all the social justice work. I do all of these things. I didn't know anyone. And so I really needed to be in a space that allowed me to bring my full authentic self, but also safe space, sort of psychological safety. And I had a lot of friends who are mentors for me, like Dr. Rishi Manchanda, like Dr. Ali Khan, who had done CHCF. And so they were like, you need to do CHCF. So I was like, okay. And it was so amazing. And I think the reason is because it was the first time I felt like I could just breathe, and understand what does leadership actually mean, and what does that mean to me? What does that mean in the milieu of health, and healthcare? Really being able to apply sort of concrete, objective skills that I didn't have, like business acumen or things of that nature, and just being able to intersect those things to the strengths that I already had. When do you pull back? When do you move forward? So it really, I think HCF for me was very helpful because I was new to California and I was able to, I have lifelong friends in it. And they're really important thought leaders. They're part of my kitchen cabinet to really be thoughtful about, like, are we making how do we make our communities healthier and safe, and being able to be contribute to those pieces. And so I think a lot about that. Now, I think there's also this element, like, I've grappled with things like, do I need to go to business school? Do I need to do this, that, the other? I think, like I said, I'm older now, and I really feel like surrounding myself around my peers who are my friends, who are also my mentors, are really critical because you learn so much from them. And I think that is the best schooling I could ever be in. I think being in very sincere and authentic fellowships like the CHCF is also important because you need to surround, this is a collective work. It takes a village. And I think you need to surround yourself around people that are like minded, who can expand your ways of thinking, who can challenge you on the things that you thought were the right way to think, who also celebrate curiosity, celebrate mistakes, and so that to me is how I think about growing your leadership. I think that people who tend to be in leadership positions for long periods of time who don't do those things are actually part of the problem.
Yeah, I actually got my MBA before the CHCF, and the MBA, I found it extremely helpful. One, in the systems I was in, my credibility as being more than a physician was being challenged a lot. So it did get me a little bit of an in there. But at the same time, I think for the first time from medical school to psychiatry to child psychiatry training, I was in a group of people not wanting to do exactly the same thing as I was. So there were like Navy SEALs, fighter pilots, veterinarians. There was a really broad group of people working for Samsung and biotech. So that really helped. I think some of the systemic problems are common across industry. So that really did help. But then CHCF, I think cathartic is the right way to describe it, because I've never entered a room and within 30 minutes, you feel connected to everybody there.
That's right.
And it was really a different experience than all the other trainings or leadership programs I've been at. So it was incredible for sure.
Yeah, and I think, California Healthcare Foundation is very intentional about, like, building a cadre of health leaders for the future of California and the Californians and their health, right? And I think that authentic, like, sort of mission is really, it calls to folks like you and me. And I think, but you have to be surrounded by people who think that way. And I think a lot about, like, what you're saying about MBA school. I do think it's this exposure to different people doing different things in life. It's kind of like why you want to encourage your kids to travel, be exposed to different ways of life. I think the thing also that what I liked about CHCF also was that how money drives health. I think we have perceptions of what it is, but really being able to tease out those pieces of how money drives health. And what I loved about CHCF is, like, challenging, is this the right way to do it, not do it? And being in conversation with people who did come from the money lens or who came from the care delivery lens, and being able to have, like, really thoughtful conversations about that. I don't know if we could do that in an MBA school per se, right? But I think for CHCF that was very big teaching moments because it allowed for me to look at money and healthcare very differently. Because I think back in the day I would have been like, screw health insurance. We have to understand how those systems operate in order to know how it can help our communities and do that work.
I think right now, in my view, understanding healthcare finance is probably one of the most important ways where healthcare leaders, like if they understand it well and how to use financing well, can impact healthcare really a lot. And that is, like, I think that's a major gap. And not just in physicians, but even many nonprofits and their finance teams don't have the level of understanding that I feel like they should. Um, Okay. So about a year and a half ago, you and your amazing co-founders, all of whom I've met, founded MitoKhon
MitoKhon, yeah, MitoKhon, uh-huh.
Advisors. Tell me a little bit about that inspiration to do that and the work you're trying to do.
Yeah, so we all had very lived experiences as women in healthcare in different sectors, and I have this great fortune that I got to know Katie Abbott and Shika Papo, who Shika's a physician, Katie is not a physician, she's a healthcare executive, and I've worked with them both in different spaces and places. And we all had a similar story to tell and sort of this lived experience, bad and good, in the healthcare. And what we realized was that we really wanted to build a safe space for women leadership and women in healthcare, but also like just bring our brilliance to the table. And so three of us founded MitoKhon Advisors. MitoKhon comes from sort of the Greek mitochondria. Mitochondria is only DNA is only in women. So it's passed down to the children. And so that's really where we took MitoKhon, and really just celebrating a space to do good impact work. We believe in communities thriving, and we also know health is in everything that we do. Health is in all policies, whether it's housing, domestic, foreign policy, it's in climate policy. Health is in everything that we do that makes us human. And so we decided that we wanted to have a women-led, physician-led, BIPOC-led firm to really show that A, women really get it done, and B, create a space where we could really shine as the leaders that we are and not have anybody dictate what we're supposed to be doing.
Last two questions for you. I think what is the most exciting or challenging problem you're working on today?
So we're doing a lot. So in MitoKhon, we now have sort of 4 lines of business. We're in the public health space. We are in the care delivery space and models of care space, and really thinking about how to embed in community-based organizations and be the health piece to it. We are also advisors and consultants for government spaces. And then we also do incubation and innovation. And so what we realized is that most of the important work that we're doing right now really is being a part of the conversations and designing for folks who are extremely marginalized by where we are in a current state in healthcare in the United States. With the passing of the HR1, it's been really scary for our communities, and I see it firsthand. People are going to become uninsured. They're going to get sicker. They don't have places to go. They're going to community-based organizations and saying, I'm sick and I don't know what to do. And so we have started to design to embed into community-based organizations, and this is stuff, this is work that's been done in healthcare history, right? Black Panthers did this, where they built community health clinics. Young Lords did this. Cesar Chavez with the farm workers has done this. I mean, we have Underground Railroad who helped people and created conductor systems. So we took a page out of each one of these spaces and places and really just went old school. I think that part is really exciting to me. I am worried about what is happening, and I think it's really just detrimental to our community and just across the United States. And so what we are building for is a future state for healthcare for folks who are going to be falling off of the grid.
Yeah. And even last week, a 2 billion cut and then reversal of the cuts. I think a lot of the damage is not just is short term, as in we are viewing the short term damage incredibly critical, like people losing care, right? But also, I think as an industry, the people who are let go first are people who are unbillable critical pieces of the healthcare. Managers, peer support, SED counselors. These are the people who are going to be and RNs even are going to be let go first because like therapists or physicians are able to bill for their time. But without these critical pieces of infrastructure and people in healthcare, we cannot do the complex work of community medicine today. So I think I'm also concerned that this also causes long-term damage to people in those roles, feeling that this is a good place for me to invest years in to build a life around. Let me ask you, the last question is, you care about so many things. How do you navigate? How do you spend your energy so that you also have impact, which requires a lot of immediate focus, but also longevity of impact?
Yeah, I mean, so I think, in 2020, my little sister was killed right before lockdown and during when lockdown for COVID. And I never felt such a shattering in my life as I experienced that. And in that, I got extremely clear. Like it was like you can kind of go down two paths, right? One is a very dark road of just rage that you can't describe, and it's like, and I could get very angry, or I could find clarity and purpose. And I really am grateful that I was able to take the road of clarity and purpose. And what that meant was, and it's almost 6 years now that she's gone. And what it really meant was being very true to myself and cutting out the noise over the things that I'm supposed to do, the things that, that's supposed to make me successful, or whatever those things that we've been conditioned to think that that is what it is as a healthcare leader or a person in healthcare. And what I realized was that the things that really mattered to me was justice and people thriving, watching people find joy. And so when you start to find out what those things are, that really is who you are. You start to cut out the fat, really, of all the things you're supposed to be a part of, not part of, blah blah blah, whatever, things that just don't matter. And what I realized is I started to find a thread of commonality in all of the things that I care about, really just sort of functions on those premises, like justice, joy, and being able to have communities thrive. And so I got involved in the things that matter to that. And so, you know how there are people who have FOMO. I had a colleague who once said, well, I have JOMO, joy of missing out, right? I don't need to be a part of the things that don't serve me well. I don't need to be a part of things that don't serve joy, justice, and community. And so I now am involved in a lot of things that really have that commonality. So it doesn't feel like extra work, really. And so, I'm on the board for the ACLU. I am involved in the community organizations that are taking care of the community that I live in. I will take time to be an advisor if I'm asked to other communities across the country, whether it's New York City or Chicago or wherever. And, as long as it's serving community joy and justice, I don't feel like it feels like I'm spread out, to be honest.
Yeah, no, that's great. I think that's a good way to kind of narrow it down to the real things that really matter. And thank you for sharing the story here. So thank you, Manisha. It's a pleasure talking to you always. I appreciate you joining us on the podcast, and I know people will get a lot out of this, hearing your story and your journey.
Well, thank you for having me.
Not a problem. Thank you so much.